There is an actual anatomical tripod. And now most anatomists don't call it the anatomical tripod, but you will see that occasionally in some texts. Instead, most anatomists would call it the pes anserinus, which means goose foot. And it's where three different muscles are all going to converge on the exact same spot. And in today's video, we are going to be meeting the gracilis, which is one of the three that attaches at this pes anserinus. And gracilis is the most slender of all of them. In fact, that's exactly what gracilis means. Now, to actually pull this off, we are going to be using a 100% free Kenhub article that we've gone ahead and left a link down in the description below. So I strongly encourage you to check this out yourself. You can follow along with me. It's going to make the experience a whole lot more rich. But let's go ahead and look at this muscle in isolation, because this belongs to a compartment of the thigh called the medial thigh compartment, except almost no one calls it that. Everyone instead calls this the adductors, or these muscles the adductors. Now, this is the most medial of all of them, meaning this is just on the inside of your thigh, right? You can feel this yourself, and that means like when you put your legs together, both your gracilis, I don't know, they're going to come together and they're going to kind of just have this relationship like this. But what I want to do is go over its attachments, and then we'll go over its functions, and we even have some animations that we're going to be able to look at to see this thing actually working. So first thing we're going to look at is its origin. So its origin is going to be all the way up here at the pubic bone. Now, here's the thing, is muscles, as much as, you know, at least my students sometimes get a little upset when a muscle seems to be attaching at multiple bony landmarks, or as a bony landmark just being a spot on a bone. And I always tell them, it's like, well, hey, you know, these muscles, you know, they weren't like, oh no, I can't go to that bony landmark. I can only stay right here. The reason I say that is because the gracilis has kind of a broad attachment. And so its origin is going to be spread across about 3 different spots. And by the way, let's just quickly also mention that an origin is going to be the more stable end of the muscle, meaning it moves the least. So in this instance, this is going to be the origin, and then the insertion is going to be down towards the knee. So if we look right here, you can see the sacrum. So let's look at this first. You can see the sacrum right here. That's going to be that triangular shaped bone. Then we can see the os coxa, which is your gigantic hip bone. And the thing is, the os coxa is actually 3 different bones that have fused together. And so we can kind of like divide it right here. So do you see where like the femur, which is this really long bone here, is plugging into the os coxa? It's plugging into it at a spot of the os coxa called the acetabulum. Acetabulum actually translates to vinegar cup. So somebody at some point thought that you could dip vinegar or put vinegar in there and dip your bread in there. I don't know. Hopefully they weren't really doing that. But I mean, I see where it's coming from. But around that acetabulum is where the 3 different bones fuse to form the os coxa. And the reason I bring this up is because this chunk here that I am outlining, this is what is called the pubic bone. So the pubic bone, or pubis, is going to be the more medial of them. In fact, if we also look closely, you're going to see that there's this, I don't know, gray line here. This is what's called the pubic symphysis. This is a symphysis joint. It's a fibrocartilaginous pad that actually separates the 2 different pubic bones so they don't slam into each other, because that would obviously be no good. Well, gracilis is going to be just lateral to it, but still on the pubic bone. And so the first origin that I always teach my students is that this is going to be on the anterior surface or anterior body of the pubis. So basically, again, this is the pubis right here. And then, well, more or less. And then right here, this portion right here, this is just kind of like the body of the pubic bone. And then there's like this little projection here called the pubic tubercle. And just below that, we could say that gracilis will come up to it. And there's just this flat surface just below that pubic tubercle. And that's the body of the pubis, or this anterior surface of the pubis. So that's going to be our first origin for gracilis. And then the next part that it's going to go to is what is called the inferior pubic ramus. So if you look here, do you see this giant hole in the os coxa? This is what's called the obturator foramen, which is a fun thing to say. Obturator actually means to obstruct. And it's bordered by a bunch of bone. Well, if you look here, we can see like here's a section of bone, here's a section of bone, here's a section of bone. We call these branches, but we would actually use the Latin term for that, which is ramus. So ramus equals branch. So this portion up here is what is called the superior pubic ramus. And down here is the inferior pubic ramus, and that turns into the ischial ramus. My point here is the gracilis is going to originate on both the inferior pubic ramus, and it can even sometimes make its way over to the ischial ramus, which is just this branch that was coming from another portion of a bone that helped fuse to create the os coxa called the ischium. So the pubis fused with the ischium, and there was a branch called the ischial ramus and a branch called the inferior pubic ramus, and those two are kind of like coming together. Gracilis can be a little bit variable in its origin. It can be a little more broad. It can kind of move over to that ischial ramus. So as you're kind of looking in your textbook or your atlas, you might see, depending on the text, that it's saying it goes to the ischial ramus. Now, I typically teach my students that it mostly sticks to the anterior surface of the pubic bone and then that inferior pubic ramus, but you will see texts where it goes towards that ischial ramus. So this is going to be our origin. And then what's going to happen is this very slender muscle is going to go down and it is going to insert down here. But we can't really see it too well from this view. So we're going to go ahead and close out of this and we're going to scroll down here where we can get a better view of it. And this right here, so let's center this. This right here is showing us more muscles. Now, this is not the entirety of the musculature in the thigh, but what we are seeing here are going to be part of the quadriceps. You can see like this muscle right here is what is known as vastus intermedius. And then you can see like this one is vastus lateralis. And then we can also see another muscle here called adductor longus. I'm not going to name all the muscles we can see here. I'm just saying we've actually removed several of them so we can get a better view of what is going on here. But once again, in green, we can now see that gracilis. But this time, the knee is in an extended position. So in that previous image, the knee was in a flexed position. In fact, let's go ahead and go back up to it. And we can look at this. And you can see that the knee is indeed in a flexed position. And so that's what makes it a little difficult to see where it is inserting. So if we come back down, now as we are in this fully extended position, we can see that that tendon is coming down and it's inserting right here on the tibia. So if you recall, the tibia is the more medial bone of the crust being your lower limb, or lower leg rather. But I want you to understand that right next to it, we can see the patella, or your kneecap, and then we can see this thick band of connective tissue. This is called the patellar ligament. The reason I say that is because the patellar ligament, which is where the quadriceps attach, inserts at the tibial tuberosity. This is this bump on the front of your tibia, and you can feel this yourself. You just kind of go right past your knee. You can feel this massive bump. Gracilis inserts at a location which is described as being medial to the tibial tuberosity. So as long as you can find that bump, then you just go medial to it, so you go towards the midline of your body, you are now at the insertion of the gracilis muscle. However, if you also look closely here, you might be able to see that that muscle is traveling slightly posterior to the actual knee joint. And that is going to be absolutely essential when we talk about its function. Now, I should also mention that the nerve that is going to innervate this muscle is the obturator nerve. Obturator, again, coming from, meaning to obstruct. That is just part of the lumbosacral plexus, which is a gigantic plexus all the way up there. In fact, if I come down here, we can even see it. Why not just show you this thing right here? So right here, you're seeing the lumbosacral plexus, which is this massive braided network of nerves that are all branching off of the lumbar and sacral region. And then in green, you will be able to see the obturator nerve that is being formed by the different spinal levels coming down. And what that's going to do is then going to innervate the gracilis muscle. So what I want to do now is we're going to scroll up to the top and we're actually going to look at a premium feature. So while these articles are 100% free, we do have premium features in them, and the videos that we place at the top of each article is indeed a premium feature. But I want to show you just how powerful this is. So I'm going to hit full screen, and what we're going to be able to see is an animation of the different actions that can happen with the gracilis. So let's go ahead and just press play. And what's going to happen here first is it's going to rotate it around. And I want to pause it just because I think this is also going to really help us see this muscle isn't just going straight up and down, right? It's not just like going whoop right down to the knee. In fact, it is traveling alongside another muscle that is curving, which you can see this white outline here. This is called the sartorius. And so it's kind of following its path, and then it's going to go in behind it, and then it is going and inserting at that medial to the tibial tuberosity. But this is where we can start to see the anatomical tripod, or that pes anserinus, which is the goose foot. Because if we look here at medial to the tibial tuberosity, we can see, again, here's sartorius coming in, and look where it inserts, medial to the tibial tuberosity. And then if you look here, there's another muscle inserting right here. If we were to follow this, it's a little harder to see in this view, but this is a muscle called the semitendinosus, which is part of the hamstrings, or the posterior thigh compartment. All three of these muscles insert essentially at the same spot, right? Like, it's a broad attachment, but they're all inserting at essentially the same spot. And so the thing to understand is, remember, Gracilis came from the medial thigh compartment. Sartorius comes from the anterior thigh compartment. And then the semitendinosus comes from the posterior thigh compartment. So those are three different spots. And so it's like, it kind of like, I don't know if my fingers are going to really show this all that well, but that's kind of why it gives it this tripod nature. But at the same time, if you look at how all three tendons come together, you can kind of think of it as being like a goose foot, right? Like, there's even like some webbing with the connective tissue, and that's how it gets the name pes anserinus. So there is your anatomical tripod, or your pes anserinus. But if we also look from this view, you can see that the tendon is traveling slightly posterior to the knee. Again, that is going to be essential. So I always encourage my students to orient themselves as soon as they look at a view. Just know exactly what you're looking at, because that can help you determine what is going to happen. So let's go ahead and press play. And what we're going to see is this muscle is capable of hip flexion. Now, depending on the text, you're going to see it suggesting various amounts of it. Some texts suggest that there is a significant amount of hip flexion. Other texts suggest there is minimal hip flexion. Just understand, the way I always describe this is, just because a muscle performs an action does not mean it is very good at it. Some muscles are what are called prime movers. A prime mover is a muscle that does the majority of a movement. Others are assistant movers, meaning they just help with that movement. But even within assistant movers, there are, bigger assistants or more relevant assistants. So in my estimation, Gracilis, I've always taught it as being a very minimal hip flexor. But if we were to go back, and I think this is really important, I'm going to come back here. Again, we'll have it kind of turn, and we'll be able to see this, right? Because when you do this, you can start to see, oh, that does make sense as to why it would do hip flexion, right? Because you can see it traveling in this posterior angle, right? It's coming at this oblique angle like this. As it contracts, it's going to grab it, and the muscle's going to want to straighten itself out. And so we are indeed going to get some hip flexion. I personally think it's a little minimal, but it is definitely going to be there. So once again, we can watch this happen, and this is showing the full range of motion of hip flexion, just to kind of give you an idea as to what that looks like. But the other thing is going to be adduction. So this position right here is what we call abduction of the thigh, or of the hip. So this is where, it's kind of like you're in a jumping jack position and your legs are flailing out. That is abduction of the hip. Gracilis does not do abduction of the hip. Gracilis does adduction. So what we're going to see is it's going to grab onto the tibia here, and then when it contracts, it's going to help swing the entire limb down. So let's go ahead and watch this happen. That is adduction of the hip. Now, it's important to understand that Gracilis, as a medial thigh compartment muscle, the nickname of that compartment is the adductors. And to absolutely no surprise, that's because that's what they do. They adduct the actual hip. All right, so now what we're going to do is look at the knee actions. And so we see flexion of the knee. That's what you just witnessed right there. So imagine, we'll actually go back. I want to just kind of make sure we're all on the exact same page here. So it rotates. So this position is extension, right? The knee is in an extended position. This is you standing. So to do flexion, it's going to look like this. And Gracilis, again, when I told you that that tendon was traveling posterior to the knee, this is why that's important, because this is what allows it to do flexion of the knee. So, because if a tendon is traveling, basically this is the easiest way to kind of wrap your head around this. You always want to look at the position that the tendon or the muscle belly itself is traveling in relation to a joint, because that is going to give you essentially the answer as to one of the functions of that muscle. There's always other ones that are a little more subtle, but you should be able to determine at least one of those functions. And then there is one more action, and that is going to be internal rotation of the knee. We can see that kind of showing up in the text here, but I want to just highlight the position of the knee. So we're in a flexed position. You can see the patella, you can see the patellar ligament, you can see that rectus femoris and the quadriceps. But what I really want you to take a look at is you can see the cartilage of the femur, you can see the cartilage of the tibia, and we can see gracilis coming around, and here is that pes anserinus. Well, what is going to happen is when you are in a flexed knee position, now that tibia can rotate. If the knee is in an extended position, like you're standing, the knee doesn't really rotate because any rotation attempt is going to rotate the hip instead. But once we have broken the plane and once we are in that flexed position, it now becomes possible to rotate the knee. And what we're going to see here is it does internal rotation, also sometimes called medial rotation of the knee. So let's go ahead and watch what that looks like. So again, this is the starting neutral position. So let's go ahead and see what that looks like. Boom, just like that, right? So it's twisted inwards. Now, I want you to know it doesn't really twist that much. That is more than what you're going to actually get. And for all of us, this is about, it's really 10 degrees, which if you think about 360 degrees, 10 degrees is essentially nothing. There is a very small amount of medial or internal rotation at the knee, and that is intentional. You don't want to rotate too much because the knee's job is not to necessarily rotate. It's more about flexion and extension, but you need to have some rotation because that is going to help keep us straight as we are walking, as we're running, but also just allow a little bit of give, right? Have a little laxicity, just a little wiggle room. Accessory motion is also going to be helpful. So that is going to be internal rotation. And those are the 4 actions of the gracilis muscle. Again, this is a 100% free article. And there's so much that we pack into these articles. You'll find a link down in the description below. We tell you everything you're going to need to know about that muscle, about that structure. We go into it. We even will give you mnemonics. These articles are incredibly valuable. You get to see our amazing atlas images that were created by our incredible illustrators. So again, that is a link down in the description below. While you're down there, if you could go ahead and like this video, small things like that go a really long way in helping us here at Kenhub. And while you're down there, you could go ahead and leave a comment. Let us know what you'd like us to discuss in future videos. But as always, thanks for hanging out with me, and I will see you next time.